Okay, everyone, I'm really sorry for the inconvenience of having the loaner computer. I really do apologize. But I'm Kelsey Dawes. I'm a PhD student here at the U, and I'm also the co-founder and CEO of Diabetes Diagnostics. And what we do is we actually have an AI-driven epigenomic risk assessment for type 2 diabetes for underwriting and wellness. And you can go to the next slide.
Sorry, 1 second. Okay, now we're good.
Perfect. So type 2 diabetes is one of the leading causes of morbidity and mortality worldwide. It decreases life expectancy by about 5 to 10 years, and it has over $327 billion in economic burden in 2017, which is only increasing. For number-wise, currently 34 million Americans have type 2 diabetes already, and there's 88 million that are pre-diabetic, and that's not even including those who are at risk for developing pre-diabetes. You can go to the next slide. So currently the way that assessments are done is kind of this red box right here. And so time and the severity of the disease is going from the left to the right, and anything that is colored are the things that we can currently measure. But as you can see, since this is where we are measuring diabetes right now, and that's also how we're assessing risk, people already having the underlying disease and also those complications have already set in for quite some time, and that's really where the economic burden is in. So if you go to the next slide. Oh, it missed a slide, but go back one more, sorry. There we go, perfect. So this is where diabetes diagnostic really comes in, because this area right here is ultimately where we want to capture patients or clients before they're really starting to develop the disease, and especially before those complications set in, and that's really what sets us apart. So if you go to the next slide. So some of our competitors have also tried to capture this same area as well, and they've tried to use genetics, but is really genetics really the answer? And the answer is not quite. Go to the next slide. Because really what we found out is that type 2 diabetes is not only due to our underlying DNA, as we kind of already figured out, but also due to the environment or those lifestyles. But it's really how they're interacting together. Go to the next slide, please. But again, the current methods are measuring the DNA, the environment, or those early manifestations of the disease, but not all of them together. Go to the next slide. So to try to visualize this, if you could click 3 times. Is that current methods are either measuring the genetics, which is completely over to the left. They're measuring like BMI and nutrition, which is kind of right there in the middle, or they're measuring an increase in hemoglobin A1C, which is all the way over to the right. If you click next. And so since they're missing all the complexity of the disease, this then makes it so that they're inaccurate, and these measures are really reactive and they're not proactive, which is what is being needed to decrease the burden. Go to the next slide, please. So diabetes diagnostics, we're really here because we're trying to transform personalized medicine with precision epigenomics. And that's a mouthful, right? So what is epigenetics? Go to the next slide, please. So epigenetics is different than genetics because epigenetics is actually like these tags on the DNA that turns the genes on or turns them off. And this is measuring the environmental contribution to the disease. Go to the next slide, please. And so diabetes diagnostic using epigenetics, we're able to measure this. If you click the next like 4 slides. Perfect. And then next. And so we're able to capture all of the complexity of the disease. And by doing that, then we're able to develop a personalized risk profile that really informs the patient which risk factors contributing the most of their risk, which is enabling focused preventative efforts. The next slide, please. Clinicians can use the generated risk profile to intervene earlier and monitor treatment progress. Next slide, please. And it also provides accurate information for insurance underwritings instead of using just subjective measures. Next slide, please. And we are the only objective risk assessment that is compatible with telehealth platforms as of now. Next slide. And this is our team. And last slide, please. As I said, I'm Kelsey Dawson. I'm the co-founder of the Diabetes Diagnostics. And then my partner is Robert Philibert. He's an MD, PhD here at the U. He is a co-founder of Diabetes Diagnostics, but he's also the founder and CEO of Behavioral Diagnostics and the co-founder and CMO of Cardio Diagnostics. And both of these other companies also use epigenetic technology, and we are already in the insurance and the clinical market, and we control the IP for this entire market. And with that, I will take any questions.
Well, I just want to say good job rolling with the punches there. I know it's hard to like present when you're a little flustered with technology, so good job. I feel like this product's a little bit above me, so I didn't completely follow along. So this is like basically a technology that will show you your risk profile for diabetes. So who the consumer would be paying for this, or like the healthcare provider would be offering it, or like where are you going to meet those people in the market?
Absolutely. So I know that it was a lot of science, and I do apologize. Kind of what I found with insurance companies, and also with some clinicians, is that they need to understand a little bit of the science so they can follow along a little bit. So I do apologize, it's science heavy. But so yeah, so right now what we're looking at is having insurance pay for it. And so we already have third-party payers that are paying for some of our other tests that use very similar technology. And the insurance companies would be paying for, like life insurance would be paying for these tests for the clients, which is what they do for the paramedical testing currently. Yep, absolutely.
Got a question. So is this gonna involve like, genetic testing, like 23andMe type tests, or is it more involved than that? Is it genome sequencing? Like, what are you doing there?
Of course. So it is kind of like 23andMe, yes. So we are also using saliva as well. But the difference is that we're not using your DNA, we're using the epigenetics, which is kind of measuring your DNA, but it's different. And that distinction is important for insurance companies and health insurance companies, because legally you can't use genetics to change premiums, but epigenetics you can. And so it's very similar, but a little bit different. And the methodology, if you're familiar, instead of doing sequencing, we're actually using drop a digital PCR.
So with your AI, how are you avoiding sort of using correlational versus causational variables? So like if there's epigenetic tags related to being, I don't know, African American, and African Americans have higher type 2 diabetes, your model is gonna cause African Americans to get higher health premiums.
That's actually an amazing point that I'm really glad that you brought up. So yes, epigenetics can be racially specific because it does depend upon some of it does depend upon the underlying DNA. However, the CPG sites, the epigenetics that we do use, we've already went through and made sure that it is not specific for any of those type of demographics.
Hey, Kelsey, this is David. How are you protecting your technology from competitors?
Absolutely. So being able to use the saliva is patented. That IP is held by Robert Philibert. So we already have that kind of like locked down, and the algorithms that are used and this specific DNA and CPG sites that we are using are trade secrets currently. So my lab and Dr. Robert Philibert, we are kind of like on the cutting edge and the internationally known experts in this area. And currently, even in the science field, we're the only ones that have the knowledge and the expertise to kind of run these algorithms. Even if they kind of knew the CPG sites, currently we're the only ones that have that knowledge to do so.
Very cool. Any other questions?
I think we're blinded by science right now. Could you talk to us about What was the aha moment that led you to this solution?
So in my lab, we actually more focus on epigenetics and the technology versus just a disease or another disease. And so really the aha moment for diabetes for me was I was actually just sitting in class and I was seeing that we were trying to use these polygenic risk scores, which is basically just trying to use your genetics to see if it could lead, like if we could predict further disease. And then I'm also seeing people using a BMI and you mean some of these other measures, and just hemoglobin A1C. And so, but just from being in my lab, I really realized that it's not just genetics or it's not just the environment and the lifestyle, it's completely how they're interacting together. And so then I applied that to type 2 diabetes to see if I could try to capture that. And sure enough, I was able to. And there's been over 100 models using AI to try to predict the future onset of diabetes. But again, they're using one or the other, and they're not capturing how they're interacting together. And that is what everyone is missing when it comes to preventative medicine, especially with these complex diseases. And it's amazing, really.
So I don't remember if you said this in your presentation. I'm trying to wrap my head around what the value of this is to, say, a patient who's receiving the benefits of this technology. What would the comparison be like without and with your solution be for their life?
Of course. So as of right now, if you go into your family physician and let's say that you're overweight, you're in like your like early 40s, your physician be like, well, you have a few of the known risk factors for diabetes, but not quite yet. And maybe he won't test you at all. But even if he thinks that you have some of the risk factors, the only thing he's going to do right now is test for your hemoglobin A1C. But by the time that he does that, and it comes back that your hemoglobin A1C is abnormal, you already have the underlying disease, and the chances of you developing diabetes within the next like 10 years is over 50%, and most of the time up to 80%. And then that's when you're going to develop the complications, and then and like cardiovascular disease and these sort of things. So by the time you're measuring, you already have it. However, using our method, I can capture how your genetics are interacting with the environment before the disease actually sets in and before your hemoglobin A1C would be abnormal. So being able to do that, then I'd also be able to tell you that these are the conventional risk factors that are increasing your risk, so that then you could focus on, oh, it's my weight. Oh, is that I need to exercise more. Oh, it's actually my diet. And then focus on that so that you can prevent the disease from even being set in the first place.
Is there like a dollar amount or something that is more concrete for a person to wrap their head around in terms of like, if I don't do this, then it's going to cost me? I mean, obviously a disease is a disease, but is there something that really helps people to figure out like how that they should really change their environmental situation if they're able to?
Of course. So while we always like to think in dollar amounts, right? But from seeing patients who have diabetes, the more important thing is their time. So if you have type 2 diabetes, or especially even if you're type 1 diabetic, doing everything that you need to do to keep your glucose under control is going to cost you about at least 2 hours of your day every single day. You constantly have to think about, what am I eating, counting your carbs and switching which restaurant you're going to, make sure that you have your glucose monitor and all those other kind of things on you all of the time, if you're doing what you're supposed to be doing, to prevent really getting those severe complications. So that really is the driving factor for these patients is their time. They don't comply because of the time. And so if we could save them the time, then later on and save them the money. So once they develop the complications, depends on the complication specifically that they develop, but that can cost up to like $32,000 extra in indirect medical costs once they get to those complications. but the time is really the key for patients.
I guess I can kind of piggyback off of that. We're talking about price and all of that. Do you have a projected price point for this test?
Of course, so our other tests run about 300 to 450. That really depends on if it needs to be expedited or not expedited results. And so, but we're also currently coming up with a bundle assay as well, using some of the assays from our other companies. And so we're coming up with those price points currently.
And then a lot of your presentation was about, we're kind of dancing around the real reasons for these things. You know, we're looking at the very beginning, or we're looking at the A1C at the end. What's your competition in this area? Is anyone else doing this sort of work yet, or are people just dancing around the issue right now?
So currently our competitors that are currently being used is just really the hemoglobin A1C. So there is like an ADA risk score, which is just a score based off of known risk factors, such as BMI and age and gender and some of those things. But those are the only things that are currently being used. Some competitors have attempted to use just your genetics, but no one is using the interacting between the genetics and the epigenetics. We're the only ones that are in this space.
Kelsey, do you have an exit plan for this business? Do you plan to sell it to somebody eventually, or?
Yes, actually, just this week we were offered to be acquired already, to have our technology acquired. And so the plan all along was to exit in about 2 years or so, because I know that while Dr. Philibert and I have the technology down, a bigger company would need to come in to scale it. And so, and we already kind of knew that, but we are actually already being sought after to be acquired.
Nice. Very cool. Any other questions? We've got just a few more minutes where we can ask questions. Not hearing any, I guess I will go ahead and ask our traditional final question here at 1MC Iowa City. And it kind of sounds like, I mean, if you're already getting offers to be acquired, don't know how much we can do to help, but what can we as the community do to help you?
So not me specifically, but people like me, I'd more say. I have found that it is difficult as a graduate student, or even just in STEM, like in academia in general, to try to push out into the commercial space. And so really just supporting people who are like me, supporting the academics that are here, trying to push out into the commercial space, because I assure you we're not getting that support within academia itself. It truly is a game changer, even just mentally and emotionally, knowing that there are people out there who support us is really what's needed.
And definitely on your side of the table there, any other colleagues you have that are coming up with possibly commercial ideas, our program's here to help. So we're always here. We're here every Wednesday. So definitely spread the word on your end, and we'll spread the word on our end. So thank you so much. Thank you so much for your presentation. I learned a lot,